First of all, what is a cataract? Everyone has a lens in their eye, like a lens in a camera. When that lens gets cloudy, that's the cataract. What cataract surgery does, we take out the old cloudy lens and put in an artificial clear lens. It's a great procedure that can help lots of people see much, much better. What can you expect at the time of your surgery? Prior to surgery, you'll undergo measurements for the lens implant power. That will be done here in our office. You will be starting an antibiotic drop 2 days before surgery. At the time of surgery, when you arrive at the surgery center, they'll have you fill out some paperwork and they'll put dilating drops in your eyes. They do ask that you don't eat or drink anything after midnight, not even water. You can take your medications with a small sip of water in the morning, but it's important you do not take your diabetic medication. You'll be putting on a hospital gown, they'll put dilating drops in your eye after the correct eye is marked. Then they'll put an intravenous line and IV in your arm. Little medicine to help you relax is always a good thing during eye surgery. At the time of surgery, we'll go back into the operating room. I'll come see you before surgery, as will the anesthesiologist. In the surgery center and in the surgical room, you'll be lying flat. There'll be a microscope that I use to go ahead and do the surgery. You'll have some numbing medication in the eye, and you'll get medication through the IV to help you relax. You'll be awake for surgery, but it won't hurt. I'll make a small incision in the eye, remove the cataract ultrasound, and put in an artificial lens implant. Sometimes we use a laser to make some incisions to correct for astigmatism now. The surgery takes about 15 minutes. If we use a laser, it takes a little bit longer. After surgery, they'll take you into the recovery area. They will put some eye drops in your eye, and they'll also give you something to drink, juice, coffee, water. Make sure you feel okay. Then after 20-30 minutes, you'll go home. You'll have a follow-up appointment to be seen in the office either the same day or the next day. Your vision will be blurry the day of surgery. It will start getting better the day after surgery. It's normal for your eye to feel itchy or scratchy, like you've got something in it for several days after surgery. Artificial tears help a lot with this, but it's important you do not rub your eye. You'll be on eye drops, usually 2 or 3 different eye drops you'll be taking. You'll get written instructions that say exactly how to take them and exactly what things you can and cannot do. Most patients are very comfortable after surgery, and most patients notice their vision is already much better the next day. Others take a few weeks to see better. It depends on the individual and depends on any coexisting eye disease they may have at the time of their surgery. You'll have several visits in our office to check up on you and see how you're doing and answer any questions you may have. Most people are very happy that they had their surgery done. They can see the street signs better, they can see the reads better. In fact, that's the time you need to have cataract surgery, when you're having trouble seeing to do what you want to do. You can't see the street signs, you've got to get really close to them before, and it's too late, you've got to turn around. You can't see the fine print on the paper, or on the medication bottles, or the captions or the scores on TV are hard to see. If any of those things are interfering with your lifestyle and your vision, and a cataract's a cause, it's time to consider the surgery. There are actually some really exciting developments in lens implants that help people see really well after surgery. Some of them even make it so people don't need glasses for reading. Others correct astigmatism so that they don't need glasses for distance when they've needed them all their lives. Cataract surgery is an excellent procedure and very exciting, and really can make a huge difference in someone's life.